Dr. Miller in El Dorado. I've got a 2-pound freebie.
Calls for help come at any and every hour from all over the state of Arkansas and sometimes beyond. In this case, a tiny infant named Robert is only a few hours old and weighs less than 3 pounds. He was born 5 weeks early and will need the most sophisticated intensive care to save his life. He'll be flown immediately to a special place that can provide the best care available anywhere, Arkansas Children's Hospital. I'm Mary Steenburgen. I was a candy striper here at Arkansas Children's Hospital, and it's incredible to me how much it has grown. In the years since it began as an orphanage in 1910, Children's has become the 6th largest pediatric hospital in the United States. Over 8,000 infants, children, teenagers, and young adults are admitted here every year, coming from every county in Arkansas and from many other states. One thing hasn't changed through the years, and that's the atmosphere of loving care and concern throughout Children's Hospital. Let me show you what I mean. When you enter, you can immediately sense that this is not a frightening place, but a place filled with warmth and love, a place exclusively for children. This spirit of care, love, and hope is only one area in which Arkansas Children's Hospital leads the nation. Our transplant program is another. Sarah is 15 years old and has had to undergo dialysis treatment since she suffered kidney failure a year ago. A suitable donor organ became available just an hour ago. Dr. Watson Arnold is the Chief of Pediatric Nephrology.
We've done an average of 15 kidney transplants a year since our program began in 1987. And it's been wonderful to watch so many of the kids who were once connected to a dialysis machine for hours each week now growing into active, healthy young people. Transplants give them a second chance at a normal life.
Children's Hospital is also approved to perform heart transplants, and we're the only hospital in a 5-state area that offers a special type of pediatric bone marrow transplant, giving hope to children with devastating forms of cancer. Another unique capability at Children's is the Ilizarov bone lengthening technique. 12-year-old John suffered an ankle fracture while sliding into home plate. He was safe, scoring the winning run, but unfortunately the growth in his leg stopped, resulting in a severely bowed and shortened leg. Dr. James Aronson, Chief of Pediatric Orthopedics, has studied with Dr. Ilizarov, a physician in the Soviet Union who developed an innovative technique for lengthening injured bones. Dr. Aronson was the first surgeon in the United States to use the Ilizarov technique and felt that John was an ideal candidate for it.
First, thin wires are surgically inserted across the limb, through the bone. These wires must be stretched as they are attached to rings which encircle the limb. The bone is gently cracked and the rings connected for stability. John lengthens his leg himself at home by gradually turning the rods between rings at 1/4 of a millimeter 4 times a day. Amazingly, the body's natural healing processes allow the bone and soft tissues to grow to normal length. This new technique is producing dramatic results for children like John, who otherwise would have been severely restricted for life.
Orthopedic patients are only a few of the children who benefit from the Gerald Hamrod Rehabilitation Center here at Children's Hospital. A special feature in the department is the therapeutic pool, one of only 20 of its kind in the country. Barbara Lewis is a therapist in the rehab center.
The children like the hydraulic pool, and I do too. It gives us a new and fun way to help children with arthritis, brain injuries, and many other problems. It makes it easier and less painful for the children to exercise in a way which helps them return to full function.
Little Robert, the patient for whom Angel 1 was dispatched earlier, has just arrived. Now 5 hours old, he is rushed to the hospital's Level 3 neonatal intensive care unit. Here a nurse will care for him, and only him, until his recovery, checking vital signs and administering medication as needed. Carol Elkins is a nurse in the neonatal intensive care unit.
NICU is a challenge, a different challenge every day. There's a very special feeling of support and love here amidst all the high-tech equipment. 15 years ago, a baby this tiny would have had little or no chance of survival. Now, babies like Robert not only survive, but grow to be normal, healthy children. We get to share in that, to form some very special relationships with our patients and their families here.
The Cecil and Alice Pearson emergency room at Children's was where I brought my own child. My son Charlie had an ear infection and was running a very high fever. I brought him in, and there the doctors and nurses gave him the very best of care. At any hour of the day, the staff here in the ER is ready to handle any child's emergency, from a sprained wrist to a life-threatening injury. It's one of the largest and busiest emergency centers in the state, and the only one where doctors specializing in pediatrics are available in-house 24 hours a day. Children's has developed a unique expertise in an area of treatment that has made it possible to accept patients over 21. The Burn Center, supervised by Dr. John Cohn.
Most of the patients who come here have a long, difficult road ahead of them. At Children's Hospital, we try to ease their recovery from intensive care to rehabilitation with specially designed facilities and treatments. These custom-shaped masks help reduce scarring after the initial healing has occurred. The real heroes here are the children and young adults who fight back against these devastating injuries.
Still another area of leadership at Children's Hospital is the David Clark Cardiovascular Center. This is Bradley, born 3 days ago. A serious heart defect was suspected shortly after birth. Dr. J.B. Norton, Chief of Pediatric Cardiology, explains.
Bradley's pediatrician first suspected a heart problem because of the baby's progressive respiratory difficulty shortly after birth. He referred the baby to the Arkansas Children's Hospital, where after extensive testing we were able to show that the heart was structurally normal, but that the pulmonary or lung arteries were so tightly constricted that little or in fact almost no blood flow was able to get to the lungs. That's why his oxygen concentration was so low. Knowing that this is a condition that will improve spontaneously if the baby can be kept alive long enough, we placed the baby on ECMO, extracorporeal membrane oxygenation. This essentially is a heart-lung machine that allows the heart and lungs to rest while the lungs are improving on their own. This is the kind of technique that is essential in order to manage this kind of complicated heart-lung problem. And this is the only place where that kind of technique is available in Arkansas.
Laura is 9 and has been returning to Children's as an outpatient for chemotherapy. Today, Dr. D.H. Berry, Chief of Oncology, will get to share with her the results of a test that shows good news.
What Laura wants to hear most is the word remission, and that's what we will be able to tell her today. She understands that it means that she has a better than 50-50 likelihood of becoming a long-term survivor. More Arkansas children with cancer come to Children's Hospital than to any other facility. More than 200 children are treated here each year. Our cancer survival rate is equal to any in the nation, and we want Laura to continue to be a positive part of it.
The clinic where Laura receives her medication supports the hospital's hematology-oncology division, but it's just one of 60 specialty clinics that offer outpatient services in virtually every area of pediatric medicine. One of the fastest-growing clinics is adolescent medicine, another comprehensive program found only at Children's Hospital. Teenagers and young adults have unique health care needs, and the Walmart Adolescent and Young Adult Unit is another part of this special program that's designed exclusively for them. Tragically, there are still illnesses that we know very little about, and problems that we still can't cure. Just as important as its leadership in programs offering medical care, Arkansas Children's Hospital conducts a wide range of exciting research programs. Dr. Robert Pfizer is chairman of the Department of Pediatrics here and is actively involved in research into children's health problems.
Research offers our children better diagnostics and therapy, and it attracts some of the best physicians in the United States to our campus. Children's Research Center has the potential to become the leading research facility for pediatric medicine.
Children's Hospital also has a very active teaching role that educates medical students, residents, nursing students, and others. Dr. Betty Lowe is medical director of Children's Hospital.
Children's Hospital has had an educational affiliation with the University of Arkansas for Medical Sciences since 1969. This means that the medical students, the nursing students, the paraprofessional students all come to Children's Hospital campus for their pediatric education. In addition, we attract some of the brightest young physicians in the South to our pediatric residency training program to become pediatricians of the future. In this way, we provide the most up-to-date medical education to those who will be caring for Arkansas children in the future. Our role as a teaching hospital not only means better care for the patients here today, it also is a benefit to the children throughout the state.
Dr. Randall O'Donnell is the Chief Executive Officer here at Children's Hospital. Caring for patients, teaching young medical professionals, conducting research. There's certainly a lot of activity going on here each day.
That's true, Mary. One of the most important parts of my job is seeing to it that we pursue all three of our missions at Children's Hospital: service to patients, education, and research, and seeing that we provide an appropriate environment for each.
Is that why there's so many playrooms here?
Well, yes, of course, play is an important part of any child's life, but it's especially important when a child is faced with a stressful situation, such as being in the hospital. Playroom activities are also used in therapy for children. They help us explain the medical procedures that will be happening to them. Our award-winning psychosocial programs are aimed at easing a child's fears about being in the hospital.
By late afternoon, Sarah is resting well and being closely monitored following her kidney transplant. Her vital signs are good and there is no sign of rejection. John and his family are packing. He gets to go home today and will have his Ilizarov device removed in less than 6 months, when his legs should be grown to normal length. Little Bradley's lungs will have a couple of more days to rest before his parents hear the welcome sound of crying. Laura has stopped by the oncology unit before going home to share her good news with the nurses who have become family friends. Robert's father has arrived to help care for his newborn son. He's called his wife, still in the hospital at home, to tell her that Robert is going to be okay and that he'll be able to come home as soon as he's grown a little bit. We've had a brief glimpse into a day in the lives of some very special children. Children whose lives are made better, stronger by the efforts of dedicated, highly capable people. They're people whose warmth and caring is combined with the most advanced tools to give children their best opportunity to enjoy good health. Our look comes to an end, but their work never stops. Another call for help has just come in. Another child, somewhere in the state, needs the special care that can only be provided here. Other calls will come in tomorrow, and the next day, and again after that. For every child in the region who needs medical help, and for his or her family, this extraordinary place, Arkansas Children's Hospital, will be here to provide unsurpassed diagnosis, treatment, and that extra measure of love, hope, and healing.